And lastly, at this time, thank you for doing that. Lastly, at this time, the department is not allowing external use of AI note-taking bots in our meetings without an advance accommodations request. If that is an accommodation that you need, please email John Barry, which is at the bottom right of the screen that you are seeing, and he will be able to assist you. We do. The Department of Healthcare Policy and Financing administers Health First Colorado, which is Colorado's Medicaid program, the Child Health Plan Plus, otherwise known as CHIP Plus, and other healthcare programs for Coloradans who qualify. Our mission here at HICPUF is to improve healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. I'm really excited because we have a great agenda for you this afternoon. We have a few people who are going to be providing some important information and updates. And then at the very end, I'm going to be providing you with some survey questions where you can gauge your interest in possible future TSAC meeting topics, as well as we'll have some questions that are specifically directed for transition coordination agencies. So just to review our agenda, first we're going to be hearing about PASSAR. Margaret Anderson is going to be providing an overview and some updates. We'll be hearing about peer mentorship from Janelle Pouillet, and then Matt Bohannon is going to be making an announcement about a staffing update here at HICPUF. Without further ado, I would like to introduce Margaret, who's going to be providing some information on PASSAR. Thanks, Margaret.
Perfect. Thanks, Amy. So for those of you that haven't met me or haven't seen me the last time I did this presentation, I think it was quite a while ago for this group. So thank you for inviting me and allowing me to talk with you guys. I am the PASSAR administrator, as Amy said, and I work here at HICPUF. So I'm just going to do a high presentation of PASSAR just as kind of a reminder of what PASSAR is. So if we could go to the next slide. All right, what is PASSAR? So PASSAR stands for Pre-Admission Screening and Resident Review. It's a powerful and effective program that was established by the Centers for Medicare and Medicaid Services, or CMS, to ensure that individuals with serious mental illness, or SMI, or intellectual and or developmental disabilities or related conditions, which we refer to as IDRC, are placed in the least restrictive setting and receive recommended interventions to improve their quality of life. More recently, the PASSAR program has emerged as one of the key methods and most effective tools for identifying persons with these conditions and providing the needed care and services. Next slide. So PASSAR in Colorado. So here in Colorado, PASSAR is administered by the State Medicaid Authority, which is HICPUF. PASSAR is a unique program in the fact that it's partnered with 2 additional state agencies. So the clinical oversight for PASSAR is the responsibility of the State Mental Health Authority, or SMHA, which is housed within the Behavioral Health Administration, or BHA. We love our acronyms here at the state. PASSAR also works closely with the Colorado Department of Public Health and Environment, or CDPHE, and they're the state agency who's responsible for the oversight of those federal PASSAR regulations during their nursing home surveys. Next slide. So the PASSAR screening and evaluation process. So I'll just do a high level of what is involved. So PASSAR process involves a level 1 screen and, if needed, a level 2 evaluation. The level 1 screen is required for any individual, regardless of their payer source, admitting to a Medicaid certified nursing facility prior to their admission. So the level 1 screen involves the completion of a screening tool to determine if an individual has or is suspected of having a PASSAR condition, as mentioned, an SMI, ID, or RC. Level 1s are submitted by our hospital staff, nursing facility staff, and our case management agency partners. If the level 1 screening is positive for an individual having or is suspected of having a PASSAR condition, then a level 2 evaluation will be performed to help determine the most appropriate placement of an individual, considering the least restrictive setting and whether specialized services are needed. Those level 2 evaluations are completed by independently licensed qualified mental health providers who are contracted through our PASSR vendor. Once the level 2 evaluation is completed, the state PASSR staff review and approve the level 2 evaluation and issue the notice of determination, or NOD. That is the legal determination of the PASSR findings. So in the end, you'll have the level 2 evaluation, which is your clinical documentation, and then the NOD, or notice of determination, which is the legal document. So the level 1 and level 2 PASSRs must be completed pre-admission, or the PAS in PASSR, once the individual is in a nursing facility and there's a status change or resident review. That is when the PASSR could have a new level 1, or if needed, a level 2 evaluation. All right, next slide. All right, specialized services. So needed specialized services are identified based on information collected during the level 2 evaluation that I talked about in the previous slide. These services are then reflected on that notice of determination letter, which is provided to the nursing home as well as the individual. If the individual was determined to have a PASSR condition, the nursing facility is now required to provide the specialized services listed on that NOD. If the person was not found to have a PASSR condition, those are now recommendations. And I always encourage our nursing facility partners to incorporate those specialized services listed, because they are also federally required to meet residents' behavior health needs. And like I said, it's completed by a qualified licensed mental health professional, so it's a great starting point. Next slide. All right, some PASSR interesting facts. So in Colorado, we currently complete about 2,500 level 1s a month, or about 30,000 annually. Historically, about 10% of those level 1 evaluations trigger the need for the in-depth level 2 evaluation, so about 250 each month. Each and every level 2 evaluation is reviewed by the state, not only to ensure quality, but also to ensure that it is clinically appropriate and that we agree with the specialized services. In Colorado, those mental health level 2 evaluations are also reviewed and co-signed by a psychiatrist. And our main stakeholder groups for PASSR are our hospital providers, our nursing facilities, and our case management agencies. All right, next slide. So I'm excited to announce that HCPF has partnered with a new PASSR vendor, Maximus. They will be taking over the contract beginning 7/1/25. With that new vendor comes some changes, and I'm just going to highlight a few of those changes. So we will be implementing a new level 1 tool. It's going to take about 7 to 10 minutes for our stakeholders to complete, but it's going to be a much more thorough screening tool and really should help with our entire screening process and helping us determine those folks with that SMI, ID, or RC. So with that more thorough screening, we're hoping to get down to about 7% of our level 1s triggering for that in-depth level 2 evaluation. So again, Maximus will begin their contract with the state on 7/1, and we're very excited for this change. Next slide. All right, so for PASSR contacts, I have included the link for the HCPF PASSR webpage. On this page, you will find the link to the Colorado Maximus page, where they will have training, as well as additional resources, FAQs. So great resource to flag. I've also included my contact information. It's also on the PASSR webpage. If you don't have this slide, you can find it there. So that is my very high-level PASSR presentation for you guys. And if you have any questions, I'm happy to answer them.
So much, Margaret.
Sure.
If we can just hang out for just a second in case anyone's like me and struggles to find their unmute button.
Yep, and I'll hang on the call. If people have questions throughout, they're more than welcome to put them in the chat or reach out to me via email.
Wonderful. Thank you so much. Very exciting about the new vendor and new process. Great. All right, now we're going to pivot and hear from Janelle Pouillet about peer mentorship.
Thank you, Amy. Can you hear me okay? Great. Thank you so much for allowing me to present today. I'm actually a benefit manager within the Office of Community Living, and I manage several benefits. And the transition services are among those. And transition services are those benefits that are available to members who are transitioning into the community. So these are Medicaid members transitioning into the community and enrolling on a waiver. And these are for the adult waivers. Peer mentorship is one of the four services currently offered. The four are peer mentorship, life skills training, home delivered meals, and transition setup. We've got something happening that's pretty exciting and a great opportunity with peer mentorship. So I just wanted to do a quick little high level overview, and I'll let you know what we have in store after. So if you wouldn't mind, the next slide, please. So what is peer mentorship? So our waiver defines it as support provided by peers to promote self-advocacy and encourage community living among members by instructing and advising on issues and topics related to community living, describing real-world experiences as examples, and modeling successful community living and problem solving. Next slide, please. So what does that mean? What that means is this provides an opportunity for peers, peer support to provide shared experience and emotional support. And those can include navigating daily life, helping the members to secure housing, manage day-to-day responsibilities, helps with relationship building, and also, if needed, overcoming isolation. Skills can also be acquired for budgeting, meal planning, transportation, healthcare management, scheduling doctor's appointments, or visiting a restaurant. And additionally, community integration can include helping to introduce a member to local activities, job training programs, visiting social groups to kind of prevent isolation, and also volunteer organizations. Next slide, please. So, who qualifies or is eligible for these services? So, as mentioned, these are members who are on Medicaid transitioning into the community from institutional care and enrolling on an adult waiver. So, this is the BI, CIH, CMHS, DD, EBD, or SLS waivers. Additionally, an assessment performed by the case manager would determine that the member demonstrates a need for the peer to mentor them in acclimating to community living. There would also be a potential risk to health, safety, or institutionalization without this service, and there are no other resources available for the member to meet this need. Next slide, please. So service limits, the service is actually available for a member to access for up to 365 days. And that meter starts the first day of service. The members can utilize the service for up to 6 hours a day and for up to 40 hours a week. If needed, under extraordinary circumstances, the department can review to extend that service to provide that member more supports. Next slide, please. So this is what I'm really excited to talk to you about, and that's what's next. So per the Department of Justice, by October 31st of this year, the state will implement a plan to promote access to peer mentorship. And what this will do is open up this service by creating training to case managers, transition coordinators, and care coordinators. And this will help to enhance the recruitment efforts of bringing more providers on, making sure anybody who's eligible for this service is aware that it's available to them. And I think that's all I wanted to mention about that. So next slide, please. All right, so at this time, I just wanted to open it up to any questions. If anybody wanted to know anything additional about it, if you had something to say about the service, or anything else you wanted to mention at this moment? And not seeing or hearing anything yet, that's okay. Your opportunity does not end here. May I have the next slide, please? So what we're looking for is to see what our stakeholders can tell us. And so we're really seeking information from members, those that may be transitioning into the community, those that have transitioned, our case managers, providers, and what we want to know are things that can help us enhance this service. One, were you aware that this service was available? What type of experience training do you think would benefit the member the most? Do you have any feedback or personal experiences that you might be able to share? And next slide, please.
You see, we have a hand raised. Monique, did you have something to add or ask?
No, I'm actually really excited about this service. I wanted to tell Janelle that. Like I've had, 3 or 4 members say, "When can I get out there and tell everybody about the service?" So we're really looking forward to implementing it.
That is thrilling, Monique, and I'm glad to hear you say that. I feel that this gives us an opportunity to expand what is really an underutilized service. So I'm really going to be hoping that we can get some input from you because I know that you know quite a bit firsthand about this service and probably have some pretty great ideas about what we can do to get the word out and make sure that people who need it can access it.
I would love to talk to you and Matt about a particular member who is going to need accessible transportation, but he is ready to go.
Right. That's good to know.
That's
Well,
our
yes.
favorite member in Pueblo. Yeah, he is ready to go.
Oh,
He says,
very good.
"Can I go to the facilities yet?" I said, "Just give me a second. Wait till we figure out." So,
That's exciting. So, yeah, absolutely. Reach out to me and we'll start a conversation on that right away.
okay, awesome. Thank you.
And I see Megan had mentioned in the chat, says, we're aware of the service, but don't seem to have any providers in our area, Montrose. It would be a great service for members if we had providers. And thanks for mentioning that, Megan. What I did realize is we probably have 3 times as many providers enrolled as we have that are providing the service. So we're reaching out to those providers to see if they needed some assistance with this, to find out what it is they need from the department to begin providing services for this. If you know of any agency or anybody who may be interested, please don't hesitate to reach out. But these discussions are starting right now. And so that enhancement of the service also includes expansion of our provider network. So I'm glad you mentioned that.
Hi, this is April. I'm in Pueblo. I'm an options counselor. Monique, when you get a chance, can I be part of that conversation too? Just so that way I'm aware of it as well too.
Oh yeah, because we're gonna need your help
Yeah.
coordinating. So I got you,
Yeah,
April.
absolutely. Thank you.
Yes.
That's wonderful. Any other questions for the time being? All right. Well, the next slide is my contact information. And so please feel free to reach out to me directly. In addition to the transition services, I also do independent living skills training, non-medical transportation, and also the dental and vision enhanced benefits for DD and SLS. So don't hesitate to reach out to me at any time. I appreciate it. Thanks today.
So much, Janelle. This is very exciting. We appreciate your time in presenting. All right. Moving on to our next agenda item. Matt Bohannon, I'm going to turn it over to you so you can make an announcement about a staffing update here at HICPUF.
Well, thank you, Amy, and thank you, Janelle, for all of that information. We certainly look forward to additional conversations. And Monique, I'm not surprised that you're jumping on board. some more fun to be had. Today, I wanted to focus on some exciting news and talk to you about our transitions administrator position. For those of you that have been involved in the program for a while, you're likely familiar with Nora Bray, who has historically held the position of transitions administrator. She worked with the program for about 15 years, so she's been involved from the very beginning. And so we have been, since she left in March, looking to replace that position and working with everyone to make sure that we kind of understand the priorities, the goals that we share. And so it has been a wonderful process. We had an amazing group of candidates that were incredibly competitive. And so today, after finalizing those decisions, I wanted to be able to introduce you to that transitions administrator and give her a chance to speak. So without further ado, I would like to welcome Jay Jackson as our new transitions administrator. She started officially this week. So I think she's got everything under control and ready to move forward after day 4. But Jay has been with the state for quite some time. I've had an opportunity to work with her and just can't say enough good things about her. But I will let her tell you a little bit more about her and who she is. And then we will have a lot more as a program to share with you in the near future in terms of what that means for her moving forward. So Jay, congratulations. And if you would like to say hi, the floor is yours.
Go Jay! Go Jay!
Thanks so much, Monique, and thank you, Matt. Thank you for that great introduction. And hello, everyone. It's nice to meet you. As Matt said, I'm Jay Jackson, and I am the new transitions administrator. I definitely think Nora left a very big shoes to fill, big role to fill, and I know you all loved her and all the great work she did with this program. So I'm so excited to step into this position and pick up right where she left off and work on things with you. Just to give you a little background about myself, I've been with the state of Colorado for almost 7 years now. I started in 2000 and actually 6 years now, sorry. Started in 2019 and actually started with the Department of Labor and Employment as a grant administrator. After taking some time off to be a stay-at-home mom, I decided to re-enter the workforce, and I actually did that as an intern because I really wanted to get a feel for working for the state and working in that position. And I just kind of fell in love with public service at that point and really found what I was good at as far as my skills and helping others. And I've just taken off since then. I have pretty much lived in the grant world and worked on grants and project management since my time with the state. And I joined HICPUF about 2 years ago. And I just love it here at HICPUF. I've had a great team, and I'm in the Office of Community Living. I work with Matt, I work with Amy, I work with Margaret. And I think some of you may know me because I worked on the Money Follows the Person capacity building grant for you all that just ended on April 30th. So some of you may be familiar with me, and those of you who are not, this bill is kind of for you. My history does include working with the Department of Corrections here in Colorado on a grant that was for assisting individuals transition from incarceration back into the community. So I've really had my hands in transitions for about probably the last 3 years here. So I'm really excited to step into it in this role and look for efficiencies and help you all and take off. I'm really excited. So you'll be seeing emails from me. My email address is right there if you have any questions or want to reach out to me and connect. And I think that's just about it. If you have any questions, I'll stay available for a while. So, but I'm happy to join the team. I apologize, I missed the TCA supervisors meeting yesterday. Had a medical situation with my daughter, but all is good there, and I am back and ready to rock and roll. So, super excited to step into this role and reach out to me if you have any questions about anything.
Wonderful. So glad to have you in this role, Jay. Congratulations, and thanks for introducing yourself. All right. Anything from anyone before we move into our next agenda item, which is I have some survey or poll questions for you all. All right. This is my first time implementing some poll questions within Zoom. So lucky you all get to be my guinea pigs for this. Am I still screen sharing or no? I'm not, right? No. Okay. All right. So there are two sections of questions that we wanted you to answer if you can. The first section is, like I mentioned, to gauge your interest in some potential topics for upcoming TSAC meetings. And so the first one is about would you be interested in, and so there are several kind of topics, and you can just rank your interest, I think, from 1 to 10, 1 being not interested at all, 10 being yes, please sign me up. So the first one is, are you interested in getting kind of an overview of HCBS services? And I just kind of called it HCBS Services 101. What the array of services include, who's eligible, why, what the limits are, and just, anything that you might want to know about HCBS services. And that is home and community-based services. I'll leave it up for just a second to make sure everyone had a chance to review, or I'm sorry, a chance to answer. And since this is the first time, if you're having trouble responding, let us know, and we'd be happy to log your answer a different way. I'll leave it up here for just about 10 more seconds. All right. So I ended that poll, and here were the results. I think you can see. In case you want to see how everyone else answered. All right. Next question. Same kind of thing. You can gauge your interest in learning about waivers. So HCBS waivers, anything from CMHS, elderly, blind, and disabled, disability, CIH I'm sorry, I can't think of these acronyms off the top of my head now, the CIH waiver, and so forth. Leave this up here for just a few more seconds, give you time to answer. Thank you all for participating. This is exciting. I will end that now. Oh, a couple more are still coming in. Okay, thank you. And here are the results. So pretty good response on both those two so far, the Home and Community-Based Services 101 and the Waivers 101. Next question. What is your interest in learning? I know we've covered this a little bit periodically within this meeting, but oops, hang on, hold up, I'm sorry. I'm sorry, I'm having trouble launching this one right here. I am not able to launch this one for some. Oh, because I need to stop sharing. That's why. Gotcha. What is your interested in learning a little bit more about participant-directed programs? So including CDAS, IHSS. I'll leave it up here for a few more seconds, give you a chance to respond. All right, thank you so much. Here are those results. A lot of good ideas here for future meetings. Thank you. Okay. Next one is MREACH. If you are not familiar with MREACH, it stands for the Medicaid Reentry and Community Health, which supports individuals who are incarcerated and or coming out of incarceration. What is your interest in learning a bit more about this? All right, I'll end this one. There are those results. Just a few more, I think a few more to get your interest on. With the recent amendment of state's 1115 demonstration, there was an update to our substance use disorder program. And so you can gauge your interest on learning about updates to Colorado substance use disorder services and program. All right, I'll end this one in just a couple seconds here. Thank you. Here are those results. Also, with our recent 1115 amendment, there were some updates to some new food and housing initiatives. So please rank your interest in learning about upcoming food and housing initiatives through Colorado's 1115 demonstration waiver. Thank you so much. A lot of good interest in this one. There are those results. And this is the last one as far as asking about your interest. Are you interested in learning a little bit more about adult protective services, making appropriate referrals, information on how referrals are processed on that end, and other information? All right, I'll end this one in just a couple seconds. Here are those results. And then these next few questions are directed specifically to the Transition Coordination Agency representatives here. And the first one is about Transition Coordination Agency referral capacity. In the amount of referrals, the amount of referrals that my transition coordination agency has received after Group InReach started has been, and you can select one, not manageable at all, slightly manageable, moderately manageable, very, and then extremely manageable. And feel free to put the answer that feels appropriate, and I will not share these answers that are specifically directed to TCAs like I did with the previous ones. All right, thank you for that. Next question. Whoops. Yes or no, do you know how to contact your region's local contact agency if you have questions? All right, I'll end this one in just a second. Thank you. Next question for transition coordination agencies. Do you know how to enter an escalation if needed? Yes or no? Okay, thank you for answering that. There are two more questions. The next one is, do you know how to submit community transition referrals into job form instead of accepting them directly from skilled nursing facilities? Leave this one up for a couple more seconds. All right, thank you. And last question. How confident is your transition coordination agency about maintaining capacity to process referrals that you will receive for individual in-reach? I'll leave this up about 5 more seconds. Okay. Let me double check. I think this is all of our questions. Thank you for participating in this, my first ever poll or survey within the TSAC or the Zoom atmosphere. Thank you. So we have some good ideas. I think I'm not actually able to see all the results right now, but I think I'll be able to later. So I really appreciate your participation in everything. As always, your feedback and your input is really valuable, and it's how we can make this program better as we go along. And I believe that is all of our agenda items. I know that Chanel, I think did you want to come on and provide an update for local contact agencies?
Hey, sorry, I actually meant at the end of presentations. I don't know if you guys are done already. Yeah, sorry, I had to jump on late.
Oh, that's okay. We are just about done. We're just going to have time at the end as usual for open questions or discussion. So yeah, whatever you have, we'd love to hear from you.
Awesome, thank you. Hi, everybody. Chanel, Pugh, Enreach Unit Supervisor, if I haven't met you before. As all of you may know, we are working on system updates, adding some of our work for individual Enreach, group Enreach, into the care and case management system. We've run into a couple snags. So as of right now, we are on track to continue that work and have the trainings, but we should know very soon if that access is going to shift. So we'll keep you all posted, but I did want to jump on and just kind of give a quick update that we are working through it. We're testing all the things, trying to make sure that they are working appropriately for you all to be able to do your work when it becomes time to do that work. But we run into some things, and so we are trying to work through that with our vendors, and we'll keep you posted if we have to adjust our timelines at all. Were there any questions around the CCM or how that's going to affect any of the projects? Okay, well, seeing none, I will hand it back over to you, Amy. Also, feel free to give me a call or an email if you have questions that pop up later. And as of right now, for the local contact agencies, we will continue to have our planned training for next week, or actually the 16th and the 18th. If we have to adjust those, we will send out notice via email.
Chanel? And so now if no one has any questions about specifically what we talked about, I think you can hopefully see my screen that says questions and open discussion. This is the time that we always want to open up for any of you for any additional topics, any questions, anything on your mind.
Hi,
All
this
right.
is April.
Oh yeah,
Sorry.
please, April. Thank you.
So,
Yep. Go.
I
Yeah.
have a question on the peer support. What kind of training do they have to go through, and are they certified, or is it just like a real quick, like 8-hour training?
A great question. I don't see Janelle on the call
Oh, okay.
anymore, but I like this
Are you
question.
meaning peer support, April, or peer mentorship?
Sorry, the peer mentorship.
Okay. They don't have to be certified now.
No. Okay.
And we've never had any training, so I'm excited to hear that there's going to be some formalized training for it.
Yeah, I was just kind of wondering what kind of training's involved in it and stuff. So, just curious.
Just typing a question to Janelle. Maybe she might be in a meeting, but I'll see if she's able to answer. Thanks for asking that question.
Hmm. Thanks.
Hi, Amy. This is Pauline Bonifazi with CHT. I can't find my hand waving
Okay.
button, but I just wanted to say that we're so excited, Jay, that you're going to be leading our teams and are so excited to get you up and going. And Matt, thank you so much for what you've had to do in the last couple months to bring us to this bridge, to have Jay Jackson step in. And, we worked with you, Jay, on the grant, and you were just so efficient and communicative and professional. And this decision feels really good. So congratulations and welcome aboard.
Thank you so much, Pauline. I appreciate it all too. And you all were wonderful to work with. So I'm looking forward to continue building our relationship and everything. So I'm excited. I'm ready.
Thank you for that. Anything else? We have some time left in our meeting. Would love to hear from you if something's on your mind. I've not been watching the chat whatsoever. Okay, I can see the chats now. Thank you. Okay, I'm not hearing any questions, and so let me just put up the slide where it has the contact information. Whoops, hang on, that's not what I want. The contact information for Matt and Chanel. All right, here's the contact information for Matt Bohannon and Chanel Pugh. If anything does come up that's on your mind and you want to ask or talk about. But until then, we will look forward to seeing you again next month. I think a couple of us will maybe hang out for a second in case anyone has any questions or items to discuss. But otherwise, I hope you have a nice rest of your afternoon. And thank you so much again for joining and for participating in the survey questions. Not hearing any questions or comments from anyone else, I think I will go ahead and end the meeting. Thanks, everyone.